what AI is really good at, where the body of knowledge is so big that one person can't completely know it anymore.
Welcome to the Evolvepreneur AI Advantage Show, and I'm your host, Richard Wray. My mission is to help entrepreneurs understand AI and use it to their advantage. Join me today where we dig deep with our guest and get you the best concepts and strategies. Today's special guest is Saurabh Jain. Saurabh is a seasoned leader in technology and healthcare, currently serving as the executive chair of Opyl, a publicly listed company at the forefront of AI-assisted technologies for the healthcare sector. Today we're talking about their world-first clinical trial design simulator. Saurabh, welcome to the show.
Great. Thank you very much, Richard.
Really great to have you here. And as I ask all my guests, Saurabh, where in the world are you?
I'm based in Sydney, so it's a lovely sunny day in Sydney right now.
Oh, that's interesting. I'm just up in Brisbane and it's absolutely terrible here, the weather today. So, hey, it's one of those things. We're normally the warmer of the two, but there we go. So before we get into the truly amazing stuff that you're doing with AI, tell us a little bit about yourself.
Yeah, totally. So I'm a software engineer by trade. Spent most of my life more in the commercialization of tech rather than on the dev, which I did at the very start. My last real job was CEO of a publicly listed company called Urbanize. Grew that from about 20 mil to around 100 mil. Exited out of that about 3 years ago. Wife and I had twins. You can't be a CEO traveling 2 weeks a month if you want to be at home and be part of the kids' family.
No, I would do that.
So now what I do, so I'm on about 6 different company boards. Mostly on the technology space or a bit of a tech lens. So I'm spending about a third of my time working on company boards, a third wife and kids traveling, and I'm a bit of a meditator, so about a third of my life is meditating.
Okay.
And so one of the companies I'm working with right now do some pretty cool stuff around AI, which would love to chat to you about.
So that would be Opyl. So tell us all about Opyl.
Yeah, so look, the problem to solve there is, so the cool thing about AI is you can solve problems that were actually previously unsolvable. So the premise we've had, look, we've spent like $20 million in 3 years doing this and only just launched. But the premise we had was that all the knowledge in the world about medicines, devices, medical treatments, and how they interact with the human body is actually kind of already known. Except they're spread out in all these clinical trial documentation and documents around the world. So what we did over 3 years is we sucked down 360,000 clinical trials, built our own large language models, like a version of ChatGPT, which is hyper-tuned to clinical documentation. We used that to pick up about 700 variables of each clinical trial document. And then we try to figure out what variables lead to a trial succeeding and a trial failing.
Interesting.
And long story short, now we can actually predict whether a clinical trial will succeed with about 90% accuracy before it starts.
But based on the medicines that are being used, the approach, what is the sort of the mechanism here?
Yeah, so about 500 of the variables are more around how the trial is structured, because funnily enough, the way the trial is structured is a huge determinant whether it's going to succeed or not. And about 200 is on the medical side of things. So what's the technology, what's the compound, what's the molecule, what's the dosing, what's the frequency? And all of those things completely vary based on the condition and the phase. And then, so what we've done is we've built a model that will now predict whether a trial will succeed or not before you start.
And so this doesn't matter whether it's a new drug or a drug that's been reversioned or retried on something else. It actually would just work across the board.
Yeah, totally. So it works actually surprisingly well in like the novel drug space. If you have a lot of history, more around the condition, less about the specific drug, we're a bit better at the predictions on the side of things, just because we have a deeper data set for each of those specific conditions. But it seems to work across the spectrum. Phase 1 and phase 2 tend to be a bit harder to predict, and predictions are a bit lower. Phase 3, we get right very, very often.
So just for the listeners, you've mentioned the different phases of a medical trial. Just give us a very brief overview of those phases.
Yeah, totally. So once you start doing some drugs in humans, the initial phase is you want to just make sure that it's safe, right? So that it doesn't hurt anybody, doesn't have any toxicity about it. Second phase is when you start, you go a bit deep into that, you might look for some efficacy. So does it actually solve a problem? And then phase 3 is when you go a lot deeper, larger population size. Again, you're still focused on toxicity and it doesn't have any adverse events, but then you're trying to figure out, does this actually have a meaningful impact on the condition?
So if I summarize that, then first of all, you just want to see if it goes in people's bodies, is it going to do anything? Yeah, it's as simple as that. You're not even worried at this point if it's going to do anything. It's like, is it safe to put in people's bodies? Next phase is it having any sort of effect? And phase 3 is taking it up to a much wider scale, of course.
Correct, spot on. Exactly.
And typically, how long can these phases take? Because I hear stories about, oh, there's an amazing new cure for this or that. And they say, oh, it'll be ready in the next century.
It's a decadal process. Like it takes 10 years. Like each of these phases tend to take a couple of years each. A lot of drugs fail along the way as well, so they'll never actually make it through. So they might totally solve cancer, but then kill every patient, and then you don't take that to market anyway. And then you'll spend like between $50 to $100 million going through this process. So if you can think about the amount of wastage in the system, like only about 20% of drugs actually succeed. So if you were doing something where there was an 80% failure chance, like you'd really look for a way to optimize that and to really kind of improve your chances of success. And that's kind of what we've solved for.
That is very interesting. So you mentioned earlier on that it seems more likely for a drug trial to fail, not necessarily on the drug itself, but more the way that the trial is being put together. What are the kind of the key trends that AI has identified?
Yeah, so look, I'll do a real simple one. So a simple one is like the number of patients. So traditionally, old school, they used to do what they call a power test. It's like a mathematical formula to figure out statistical significance in a population. And so you'd guess the population, you'd guess the variance, and then you'd have, great, we need 1,000 patients, which is a guess on a guess on a guess, which now is mathematically proven to make you think it's right. And that's just the way you had to do it, right? Because you had no other real world data source. And what we've found in our data, there's a real parabola to success in a clinical trial when it comes to number of patients. If you have too few, patients drop out, statistically significant. If you have too many, it actually gets harder to manage because there's more sites, there's more locations, you've got a higher chance of adverse events. So there's actually a sweet spot right in the middle. And that's how we help people who are designing trials totally tune their trials to kind of hit the sweet spot.
And when you're designing the trials using this approach, will it also give some sort of prediction on how long the trials have to run for?
Yeah, so, I mean, in terms of running, we don't do that much on the length of the trial. We'll predict when the trial's going to complete. That's more from like a competitor space. But normally the clinician will know, for this drug, it takes 6 months to kind of have efficacy. We're going to run this trial this many times, across so many patients, and that kind of locks in the time.
Interesting. And how is the medical industry taken this on board? Because you've got, I would say, two sides to this. You've got the people who are actually treating people, and then you've got the pharmaceutical industry who wants to make sure that they're going to save money and get drugs that are going to make them lots of money out there as well. So how have those two sides of the coin actually reacted to what you're doing?
Well, we've only really launched like a month or two ago. It's just like super early days. We're about, hopefully, touch wood, we'll get our first set of customers pretty soon. The initial reaction is, surely that can't be true, right? Surely you can't predict the outcome of the clinical trial before you can do it. Like, if you did that, why would we run trials anyway?
But they didn't have AI to work with previously.
No, they didn't. And if you asked me a year ago, ChatGPT would not have been solvable in my lifetime. No, like I did not think that was going to be a thing. And this is my space, right? I'm an AI tech guy, but I totally did not see that happening. But normally when you show them their trial, the trial they're working on or they're very close to, and we'll be like, oh, the number of patient touch points doesn't look optimal. How often you interact with the patients? Because again, if you interact too much, they get frustrated and leave, or they don't join the trial. Not enough, they're not compliant, and it varies based on condition. So if you're doing a life-saving treatment for a cancer patient, you don't have to do much because they're almost always going to be totally engaged. But if you're doing a vitamin study, you've got to talk to the patients a lot. So normally when we pull out some of those real-world examples, they're like, oh, wow, there's actually something to this. And it's almost like, like you always have these, like this deep wisdom for someone who's done clinical trials for 20 or 30 years. All we've done is like super codified it, super democratized it so everybody can access it. And so with someone with those real deep smart sees it and they spend a couple of hours with us, they totally get it. So I've had quite a few customers that are keen to use it. So now I'm just going to wait for the next set of trials to get started and we'll hopefully work with them.
Sounds fantastic. Does the system factor in, I'll call it the human factor, where in some trials, people feel that they're taking the drug and they should be getting better, but they might be getting the placebo. So basically, they lie. And that's a common thing that happens with medical trials. People go, oh, yeah, honestly, it's having a huge effect when nothing should be happening. Do you have any guards in there to try and work that out?
Yeah, so we don't work that out, but the way we help deal with that is to get the patient numbers right. So if you tend to have the right population size, you'll be able to actually statistically see that. And that's often when a lot of trials which are underfunded, but they do it anyway, or they only go for like 50 patients for a condition where they actually need 200, they'll often not have statistical significance because of the placebo effect. Because placebo effect is real. It could be a 20 or 30% uplift. And so often you might have a drug which actually really, really worked, but the population size was not big enough. They couldn't factor out the placebo effect, and then they never took it to market.
No, that's very interesting. It's an incredibly complex topic to cover. And for you to have identified, as you say, 700 different, different bits of data that you can pick up on to try and work out why. There's got to be so many, and a ridiculous number of combinations. I'm sure you've done the maths at some point, but there has to be so many variations there.
Oh, totally. And like 3 months ago, it was 500 variables, and we were like 87%, 88% accurate. 6 months ago, there's about 300 or 400 variables, and we were like 70, 80% accurate. What the game changer was for us was the way LLMs kind of grew over the last couple of years. So it just meant that we could turn this completely unstructured data into totally structured data that we could put like a learning algorithm over.
So when you've run this over prior trials, how accurately have you been finding it's been identified? Is it the 80, 90% accuracy that you're getting?
Yeah, so the CTO that started this, what kind of tweaked for him was, so during COVID, he ran this for COVID trials. So there was about 400 vaccines and about 400 treatments that were out in the world kind of competing to win. So he ranked Pfizer and Moderna as number 1, and AstraZeneca is like number 8. And this got published in the AFR. And, luckily that's the way that life worked out. So the model did kind of work. So now that's what kind of gave him the kind of the motivation and the validation that, hey, this actually does really, really work. And so we back test the model as well. So we train it on data from like 20 to 2018, 2018 to 2023. That's where we make our predictions. And that's where we see that we have a precision recall of above 90%.
Which is absolutely amazing. I mean, you look at some of the truly horrific things that have happened with trials over the years. And, you take that. I mean, the most extreme example I can think of is Andrew Wakefield and the whole thing where, his article got published in The Lancet. And we're talking about, potentially autism being caused by vaccines, which there is no data to back that up at all, apart from his very, very flawed trial. And so if your technology had been around at the time, I think it would have nipped it in the bud very early.
Yeah, totally. Like, it would have actually looked at these trials, would have kind of pointed out the flaws in the trial and given it a probability of success. And if the probability of success was quite low and the signal came out as positive, you'd want to just delve a bit deeper, just to either figure out the model was wrong or something is wrong in the results that they're publishing.
No, understood. That's a really intriguing way of doing it. So do you see a point with the trials as well where you actually are not going to need as many people? Because if you build up a strong enough AI model, can you actually simulate the effects of either real drugs or theoretical drugs to see if it's going to do something? Sorry, go ahead.
Yeah, totally. So, so right now there's about 35,000 clinical trials that happen in the world every year. And at some point, I hope within my lifetime, we're going to think it's completely unethical to do a trial in a human unless it's being done in an AI simulator first. And what will hopefully happen is there'll be millions and millions of trials that happen in AI, and only like 5 or 10,000 that actually happen in people. So what that means, you can overinvest in the ones that are most likely going to succeed. So, there are literally about 7,000 trials happening in the world for cancer right now. So instead of doing 7,000, you might do 1,000, but you'll overinvest in them, over-index in them to kind of push them a lot harder. So it should hopefully lead to almost like a perfect allocation of capital, and then a perfect allocation of effort and mind space and people going to what is most likely going to work in humans.
I think the medical world is one of the most important areas for AI. I was speaking to somebody just recently about this, and breast cancer screening. AI, a couple of years ago now, was already producing better results for detecting breast cancer than the standard 2 oncologists reviewing scans. So what areas are you seeing your AI being used in that you're really excited about beyond what you're doing already?
Yeah, totally. I mean, so what AI is really good at is, especially at the start, it's where the body of knowledge is so big that one person can't completely know it anymore.
Okay.
So when I first started coding like 25 years ago, like you were just a developer.
Yeah.
And then there was a front end and there was back end. Now there's specialized QA, now there's Scrum Masters, now there's SecOps and DevOps. Now a dev team actually has like 40 different roles in them because people are getting hyper specialized in their area. And that's obviously the same in the medical space, right? You'll spend your entire life focused on someone's little toe, right? And how that grows. Bit of an exaggeration, but people get hyper specialized in one area, and then they can't see the big picture. But AI totally can, and AI can totally learn the big picture and learn it a lot faster than an actual human can. And when you buddy up that AI model with a human, that's where you actually get some real magic.
So how do you make sure that there is a degree of trust in these systems? Because still, sadly, with the AI, and this is something I rail against, and this is a big reason for having this show, is people just are a little scared. And I blame, a lot of the way that technology and AI over the years has been portrayed in the media. So how do you get across the message that, no, this actually what we're doing here, this amazing thing, forget the money. This could actually save lives.
Well, we tend to not have a lot of pushback on our tech because invariably what you find, a clinician will upload their trial, will run it in the simulator, they'll play with a few permutations and combinations, and they're like, oh, I totally get this. I should have had this many patients, or I should have used this crossover method, or I should have had this intervention model, or we went for an injectable, but a competitor had a pill coming out like 3 months before me with a better chance of success. So of course it doesn't make sense for me to pursue the path that I was going to do. So we tend not to have a lot of pushback because the way we pitch it is we'll give you the optimal trial to do, and then the clinician will add all the real world constraints to it, see what they can actually do in the real world. So it's more like a decision support. It's not a replacement for a person.
Understood. And so what areas of the world doesn't have to be medical and the medical industry, where do you see AI getting really useful? Because you've been doing some great things with it. You've got this one amazing use case, which is, as you say, it's like a super brain, which is grabbing information from a million different places. Where else can you see this style of technology going?
Let me give you two buckets of examples. So one example, so the founder, he actually made his money off sports betting, which is actually the exact same thing. You have 100 variables, you have an outcome, you figure out what variable led to that outcome. And he did SQL, ran them for a long time before they got baked into the market. Then his next venture was search engine optimization, which is still running now. So a whole bunch of variables, what leads to being on the front page of Google, and you can totally back solve that. He's just released one out for golf swings. Take a video of your golf swing, figures out every part of the body, how it moves. He's given it videos of great golfers, well, what leads to someone being a great golfer. So wherever there's a whole bunch of variables and you don't know what leads to the positive or negative outcome, AI is fantastic at figuring out what leads to that positive outcome. The other part, as I kind of alluded on to right now, so one startup that I've put some money in investing in is a company called Taxology. So what we did is we went to the AHL website, picked up 75,000 private rulings, public rulings, federal cases, built into a chatbot. So now you can log on to Taxology.ai, ask it a question. Hey, I'm a podcaster working from home in this scenario, this scenario, this scenario. What is my tax obligation? And in the same way your accountant won't read those 50 private rulings that come out every week, the AI actually does. And actually say, oh, tell me, well, here's what the tax implication would be in that scenario, and here's all the references. So in that case, it's a fantastic search tool. Like Search is 2018, right?
Well, there is a rumor that OpenAI are going to be bringing out their own search engine. There was a suspicion it might have happened this week, but instead they just brought out AI that sang and chats to you now. So it's it's all a little scary in that respect.
It's companion AI now, isn't it?
Yeah. But that actually, when you look at some of the uses of AI, with like if you look at Replica, the first uses of that was actually as a companion. And sadly, a few things have happened since, but there are people who genuinely use it as a companion. And if it's getting better and better, this has to be good news.
Yeah.
One thing I've got to ask you, being able to pull all this knowledge together and to circumvent some of the phases that we may have gone through in the past, in every single field I can think of, the one concern I have about AI is creating a post-knowledge age where, those skill sets that, the younger generation coming through now that would have learned how to code, would have learned how to do whatever the job might be, they're not going to need to do that anymore. Now, don't get me wrong. There's not that many blacksmiths around to shoe horses. So, at one point, that was a really important skill. But what's your take on making sure that we use AI in constructive ways so that we can keep doing good things and we don't get into a post-knowledge age?
But the way I think about it is, like, generally, we have formal education for about 20 years, right? Part of our life. There's only so many things you can teach a person in 20 years. So there's some things you need to consciously choose to not teach them. So my grandma still complains about how I can't tell the time by looking at the sun, and I totally can't, and I totally never learned that. And I whinge how kids these days can't do times tables, because I had to memorize that back.
Get them to read a map. It's not going to happen.
Yeah, and they're not going to read a map. They're not going to read an encyclopedia. They're not going to read that kind of stuff. So
probably don't know what one is.
Yeah, they probably don't even know what the library is, except for where you go play some toys or listen to someone tell you a story. But I think what it is the reason humanity succeeds is we specialize more. And that's why as a population, we do better, because more and more people get deep into various areas. So you have to always build up this scaffolding around the knowledge in the world. So I think you just kind of accept, hey, people went from abacuses to calculators to now not even knowing how times tables work, but they can do it. So when I programmed, I had to learn assembly first, before I learned Java, and then I learned graphics. But kids don't need to learn that anymore. They go straight to some sort of, fourth generation language. They won't learn the fundamentals about how things work, but that might be okay because the tech might already know that for them. But if they had to learn that, it will take way too long to do the stuff we need to get done.
Now, that's interesting. My personal take has always been we should teach people the fundamentals, the principles. But you don't think that's going to be as important?
No, because I think the problem is if you teach people so the way I think about it is every day, like I know, in 20 years, you probably have like 6,500, 7,000 days to teach somebody before they're out and productive. If you're going to be super discriminative about what you want to spend each day on, and what they're going to be able to do that'll add value to the world, and the fundamentals are fantastically important. You got to learn how to do the real basics of counting, but then some of the stuff which the tech can do better than a person, there is less value in teaching the fundamentals. Or if you do, you teach that to a very narrow group. Well, that narrow group will want to go learn that fundamentals because they'll play that area. But 98% of the population will skip that and go play in a much more complex area.
Interesting. Very, very interesting. If there was one piece of advice that people could take away from our conversation today, what would it be?
Look, I think AI is going to change everything. It's going to be such a foundational tech. It's going to be like electricity. It's going to be like mass transportation. It's going to be like writing. Like it's going to change everything what we do. And it's one of those once in a generation things that you have a chance to jump on the bandwagon of and figure out how do you monetize this or how to use this in a good way. Is make it your friend.
I think that's some great advice. Saurabh, where can people find you? And where can people actually look at some of the amazing things you and the companies that you're working with are doing?
Yeah, totally. Look, LinkedIn is probably the easiest way. Just search my name, or I'm sure you'll pop my my details in the show notes as well.
Fantastic. And the companies?
Yeah, so the main company I'm working with right now, Opyl, that's I'm the exec chair of, and then Taxology, the kind of side hobby I'm kind of dabbling in.
Sounds fantastic. Well, look, it sounds like you're doing some amazing things. I love the concept, and if it saves money, if it speeds up trials and saves lives, it's got to be good news. Thanks for your time today.
Thank you very much. Thanks, Richard.
Well, that's a wrap on another awesome guest episode for the Evolvepreneur AI Advantage show. Just before you go, if you liked this episode, we would be very grateful for a 5-star review. Please also consider recommending the show to a friend or two. Make sure you subscribe for future episodes at aiadvantage.show right now. Until next time, I'm Richard Wray, and if you're an entrepreneur, get the AI advantage today.